Mm. Hi, my name is Dr. Gold C.W. Emmanuel, and AfroPsychologist is my brand. Today I've got a few clarifications to make in terms of the stigmatization which is faced by psychological experts, psychotherapists, for example, sexologists, for example, psychosexual experts, for example. And of course, I'm going to be talking about medical doctors, their the ways of going about treating people, and how they go about their diagnosis, and also in administration of the drugs. So who exactly has to be stigmatized? I'll leave that up to you. But in terms of the works of psychologists, I did mention previously that what the psychologist does is to understand what is going on within a person, to understand their current situation, and to understand where that whatever is causing that particular state of mind is coming from. That is very important because it helps in the intervention process, and it also helps in the healing process. And for a healing process to be permanent, then obviously we need to understand what a person is going through in all spheres, or in everything that is surrounding that person. So I came across it's like a post on Facebook, and it's like, oh, you're a psychosexual expert. You know, that sort of stigmatization that comes with, that is freaky, that is this, that is that. What the psychosexual consultant or the sexologist does not do is to examine the penis, is to examine the vagina. What they do is to listen to what your problem is, to help determine what psychological impact could be causing those problems, and how they can help you through therapy to get you out of that problem, so you can start enjoying your relationship and have a healthy sexual life, a sexual relationship with your wife, with your partner, with your other half, and to feel good within yourself. The importance of feeling good within yourself is that it helps to minimize the impact of every or any other psychological challenges that might occur as a result of the present psychological challenges that you're facing. It is true that one problem could lead to another. It is also true that whatever problem you're facing now, if not adequately solved, would lead into greater problems. Whilst you have medical condition and you go to your medical doctor then look at you, examine what the problem is. If you have a penile problem, then obviously your medical doctor will examine your penis. The examination of your penis gives him an idea what is going on within your body, what is going on with your penis. What the psychosexual consultant does is to hear from you, what exactly did you say is wrong with your penis, and what issue do you think you have with your penis, and what are the feelings that you're getting, or what are the feelings that you feel you should be getting but you're not getting from your penis. So if we're trying to stigmatize sexologist or psychosexual expert who doesn't see your penis, who doesn't examine or feel or touch your penis, then I feel that sometimes within the social context, we then operate through what is socially correct and what is available within the normal social realm and what should be said in public or what shouldn't be said in public. For a person going newly into sexology, they feel, oh, I do not feel I have to tell my parents or my other half that I'm going to be a sexologist or a psychologist, because I feel like they might think something about what I'm doing. Would they? I do not know. Would they react differently when they hear that you're studying or you're becoming a sexologist? What do you do as a sexologist, and what do you do as a psychosexual consultant or expert? You help people through their psychological problems, which is affecting their sexuality, sexual life, sexual relationship. We do not examine one's penis or one's vagina. We help with psychological intervention to understand what factors could have actually caused this problem. If it's medical factor, then obviously the medical expert then comes in to play. The medical expert then examines your penis or your vagina. The medical expert then tells you what could be medically wrong with your penis. In terms of understanding the different types of psychosexual dysfunction, I would sort of delve into erectile dysfunction and the three types where diagnoses are made, and we sort of examine if it's psychological based or if it's medical based. So if it's medical based, then it's got to be dealt with medically, and if it's psychological based, then obviously you need intervention. Now that takes me to the culture that doesn't embrace psychological intervention. I did talk about my psychosocial cultural intervention, which is to understand people's culture, bringing psychology into an environment where the importance of psychology or psychological intervention isn't actually, they do not actually mention. So if you have someone with an erectile dysfunction, which is actually based, or which is a psychologically based dysfunction, then how do you sort of balance what that person is going to, how do you find out how to help that person within that culture that neglects or frowns or stigmatizes the work of a psychosexual expert? There are many awareness that needs to be carried out in this sort of environment. There are, of course, awareness in terms of maybe workshops, maybe national awareness or advertisement that needs to go out so that people can actually start to understand the importance of psychological intervention when it comes to one's sexuality. I will explain something in terms of my Psyche Talk. In Psyche Talk, I want everyone in that forum to be very comfortable because I understand the importance of cultural background. I understand the importance of religion, and I understand the importance of the social repertoire. I understand how people form and shape themselves and identify within a social and cultural background, which is why Psyche Talk is such a forum which I want everyone in that forum I want you to feel at home. And once you start feeling at home, this is what you're going to do. You will know that it is important that psychological intervention is sought in a situation where there is no medical explanation to your situation. Sometimes you're out of job, you're not even sure what is causing this problem because you're withdrawn, you're not able to speak to anyone, and you're not willing to interact socially with people because you're internally withdrawn, and then it's sort of affecting your social interactions. I have a very acceptance predisposition towards whatever is discussed in this forum. So it is global, which means people are from different backgrounds, people will definitely think differently, and people will definitely see things differently. But then it is also important that you share the importance of psychological intervention in your different community. And this is not anything that has to do with maybe something is going on, or there isn't anybody being paid to carry out psychological intervention in a forum that is free. And it is free for a reason, for my experience, which I've seen, and for the fact that people do not readily understand the impact and the efficacy of psychological intervention, particularly going by the post which I saw on Facebook, which is like, oh, that is freaky. There isn't anything freaky about an intervention which tends to explain what could be going on within a person and how that can actually affect their sexuality and how that can affect their sexual relationship with other people or with their partner, particularly in a marriage, in a relationship. There is, however, something wrong. If you feel there is something wrong with psychological intervention, is it then worth to see a psychologist? I'll leave that up to you. So until I come back again with very interesting and spicy topic, then I would like to, at this point actually, I have a website which is www.goldemmanuel.com, and that sort of explains the sort of different types of talk therapy which you can actually benefit from if you're looking for something outside the Psychitalk forum. But obviously the Psychitalk forum is absolutely free, it's confidential, it's anonymous. When you post your whatever challenges you're facing, but again, enjoy the forum. It's a community for you to point out, take out those repression and enjoy. I've got this music playing in the background. It's something that I really do love, and it's by Gilex. Thank you, Gilex. Well, yeah. So this is it. I'll be talking about child psychology next. How the child starts embracing the culture within his immediate environment, and how that child learns to grasp information and knowledge and process information and knowledge and gain knowledge. So until there should be another video soon. So it's Dr. Gold CWE Manuel from AfroPsychology. So it is it. Bye bye.